So neighbourhood health is not new. It's been a policy ambition for about 5 decades. We've been at this for quite some time. But instead of this shift towards community orientated care, actually, we've seen the investment go into hospitals, both in terms of workforce, hospital consultants expanding, but also the money. Actually, if we invest more in primary care, in community services, and particularly community and social infrastructure, the stuff that keeps us well, that prevents ill health, but also creates health, but also supports earlier diagnosis and intervention, then actually we wouldn't need all of that. I have the privilege in this job to be visiting lots of places that are progressing neighbourhood health. And I've been distilling down what are the key things that have really helped them progress this. And guess what? 80% is exactly the same. Only 20% is different. So we're far more similar than we are different. So there's lots that we can learn from each other, but also lots of places across the country have solved each other's challenges. So it's how we share that learning better, a shift in how we work with communities in partnership. And I mean true partnership. I mean co-producing outcomes, co-designing how care is delivered, co-delivering care and co-learning, and having that true accountability to our communities. What we're investing in is building capability, so sustainability of the approach. And that means we are pairing each place with a national coach, and they are committing a place coach. And in essence, we're building this together and developing academies of good practice within systems that can then spread that learning more widely. It's about what are the principles that shape or form a neighbourhood, a good starting point for places. And these we've tested with 300 plus key stakeholders, partners across the system, including community leaders, places that are driving the change, frontline practitioners, people with lived experience, to make sure they're really grounded in evidence and experience. Really fundamentally building those deep community connections and connecting people into community-led solutions so we're not over-medicalising, such as creative health. We all know that impact that we need to have on connecting people to places, to the other people in their communities, and to purpose. What measures counts? And so we're starting to look at patient-reported outcomes, people's well-being, what matters to them, people's reported experience, people's activation, their knowledge, their confidence in managing their own health and well-being, staff experience, alongside those service utilisation metrics, which are important for the NHS, to make sure that we are looking at the whole person, the whole picture, and not breaking things up into silos like we've traditionally done.